and that is brought to about 0 degree. So the surface temperature, if you have a small surface temperature tape, it works at about 2 degrees. And that creates a good numbing effect. Though the procedure is painless, your results are pretty well. And keep all the necessary tools ready for the procedure at hand. That includes a camera, the razor, good amount of tissues, a good marking pencil, and if necessary, a magnifying lens also at times. A logbook is mandatory. I would always say one thing, it will maintain one logbook just for the patients, telling about the name of the patient and the various data used in the patient and observations at the end of every sitting, and a separate logbook about the machine. I'll show you the picture of that later. And the big fear always, I think currently it is not much there, earlier it was a chemoprophylaxis about precipitating a herpes simplex infection. Because very often patients who are not well educated, not well informed, may blame your procedure if any herpes simplex infection, a relapse or a first attack comes out. And that can become a medical legal issue also at times. And lastly, think of whether this patient has any contraindications for the procedure. In the sense, if the patient is on any immunosuppressants, if there's a pregnancy, or else if the patient has or had maybe any UV therapy or else a radiotherapy, please defer the procedure for some time. Because some of the patients are often in a hurry to get all the procedures done in one go. And this we face in Bangalore. Because a good lot of Bangaloreans are in the Middle East and they come home just for 4 to 5 days and they want all the procedures to be done in one shot, which is not possible. This is my simple OT setup. I have the reclining chair, the multi-angled tilting one. You can see the sopran accord machine, illumination on the top, the OT lamp, some wall painting or so just to keep the environment nice, and a gentle music in the background. Because any procedure will take at least about 15 to 20 minutes on an average. And as time goes on, you can finish your upper lip and chin probably in just about 7 minutes. That's the speed of this in-motion technology. And other side of the OT, you have all the setup, all the backup. I also have a small fire extinguisher, because once I had a small short circuitry and some flames coming out, not in the laser machine, with my radio frequency machine. So I have a backup of everything in the OT. And all those drawers are all full of various materials essential for my procedures. A simple photograph over here. The left hand side is the date, next is the patient's name, the area and the sitting number, whatever of that, with the phase 3 means it's the third sitting on the phase, the dosage, the total joules, the stacks, the initial reading, the end reading, and finally the total number of laser shots used on a given patient. It's one way very helpful for you. Now this has been shown and explained in detail by Dr. Dhawan. Rather, I would say this is nothing but a switch in and you can start playing with this in no time. Rather, I would say the Sony PSP3 is more complicated than this machine. You need just about 10 minutes. Even mobile phones are more complicated in handling, and this particular sopran accord machine is very easy thing to handle. Only thing, you need a good wrist. That's because the handpiece is just about 6 kilos in weight, though the entire machine is 48 kilos. And the hand machine with the tubing and whatever the laser source, you drop it once, you are poorer by just about 9 to 12 lakh rupees. That's the only thing. So you need a good wrist. So always strap the thing first around you, then only remove it from the safety hold of the machine. And all the patients, after the area is first photographed, and then after it's photographed, the area is marked. Because once you start the procedure, you will be lost totally. And to marking also, don't use a white pencil. It vanishes in no time. And a white pencil always is a very stiff pencil, and when you use the white pencil as a marker, you are likely to induce a dermographism in many patients. Don't use a black or a purple or a deep blue pencil, because These ones match the laser frequency, rather the laser has got an attraction for the chromophores, and the purple or the black or the deep blue is absorbed. So I prefer very often the pink or else a maroonish color one, and best pencil for it to use would be either a Chambord or a channel pencil. Don't look at the rate, you are going to charge the patients heavily. And to remove this pencil stain at the end, of course, you can use the Bioderma comes out with a magical water. They call it as Sensibio water. You can use this and get rid of it, or else if you have any makeup removal kit, you can use it there also. And remember, throughout the procedure, whatever the amount of jelly, the color never moves away. You can see the jelly also being applied. And I use the jelly used by ultrasonologists, and it's not expensive too. One small bottle of 250 ml will cost you just about 23 rupees. And when you buy it by the bulk, it works out much more cheaper. So use the jelly liberally, because it chills as well as eases your job. Now, just to show you some procedures, like this was one girl. Like very often, some of the patients remember about the facial hair just about 2 to 3 months before the wedding day. I always insist, please give us a breather time of at least 6 months. This girl, one thing I was fortunate, not she, very fair girl, so I could use a higher laser energy, and I could time the laser much more frequently. I do it once in 4 weeks, but here I did the laser once in 3 weeks. So at the end of 8 weeks, because the 10th week was the wedding, it was fortunate, hairs had got reduced very significantly. The girl was happy, the boy was happy, and truly speaking, the boy had less amount of mush hair than the girl. And post-honeymoon again she came, she completed her entire 5 laser sittings, and now she is settled in Dubai. So it's something very nice when you give some positive results to patients. Like this girl had vellus hairs. I did refuse laser to her, but she did insist. So here you can see at the end of 12 weeks, it looks almost the same. I'm not very happy with this. But the girl is happy because for her it's a status symbol that she has undergone a laser therapy. Because many girls take it as a positive thing to go and say, just like saying, I got an iPhone 5 or else I got a Samsung Grand. Similarly, I have undergone laser also. Very often a big thing amongst the teenagers. This is one young engineer. Fortunately, no polycystic ovary. You can see the good amount of hair reduction at the end of 12th week. The same girl at the end of 12 weeks. But one thing I'm not very happy about the vellus hairs. If it's a fair person, okay fine, I can increase the quantum of laser energy and tackle them. But in South India, we have people who have got a good amount of tan or a dark skin. So higher amount of laser energy when we use, we can create a surface burn of the 1st degree. That is the main limitation in South India, because the dark skin always has got a good amount of melanin too. So we can create a burn. And today I did learn something from Dr. Dhawan that we can increase the laser energy when the hairs are sparse or when they are rather on the lighter side. I'll give a try to that. And another new trend nowadays is to wear the low hip jeans and show the intergluteal cleft as well as the brand name of the underwear. That's why all the underwear tags come in beautiful designs. Over here, this was a demand by a girl because it seems on a Bluetooth she got a message saying that she is very hairy in some restaurant and she was depressed. So she did come running, and this was at the end of 8 weeks. She's just done about 3 sittings. Some more sittings are awaited. Now she is happy. Now we do come across challenges with the soprano accord or else in the hair removal system. Polycystic ovaries. Our knowledge is limited, very often I would rather say, to some theory and good reading just before the exams. Post exams, we are very bad in polycystic ovaries. How much can we diagnose, or how much are we well trained to manage polycystic ovaries? So it's better we start sharing these cases with the gynecologists and the endocrinologists. There are two things over here. One is you have done good thing for the patient. Another thing, you have given a patient to the gyneco or the endocrinologist, and in reciprocity